If you're experiencing hip pain specifically in the outer part of your hip, you may be suffering from hip bursitis.
Fortunately, there are exercises that we can do to relieve this pain, and we're going to show you them.
So the first stretch we're going to show is going to work the IT band, but it's also a hip flexor stretch, and we've shown it in many other videos. So what you're going to do is you're going to lay down on your back, bring both knees to your chest to start, and you're going to drop one leg off the edge of the mat and try to bend it to 90 degrees. So this is stretching my hip flexor now, but Brad, you want to talk about how it integrates the IT band?
Right, yeah, and you can do this off the edge of your bed. It is, hopefully if your bed is firmer, it works a little bit better. But one thing like Mike was talking about, if your knee has a tendency to pull out to the side, that's an indication that your IT band is tight, and we want to make sure that it's stretched out. And this will get that hip flexor. Try to keep the knee in, and then we'll show you an exercise to stretch that IT band as well.
So what I'm going to do...
Before we get going, Mike, I want to mention if you had a total hip replacement, you do not want to do this. This is for a healthy hip, or when it's painful. No surgeries prior to this.
Yes. So I'm going to walk forward, get some tension on this. First, we're going to go forward. I'm going to leave this leg back and try to keep my back nice and neutral and straight. And I'm going to slowly lean forward. It's going to have a pulling force posteriorly, trying to get that femoral head back into the socket where it is meant to be. So the last suggestion we have is to keep soft knees when standing and also walking. So what I'm saying...
Soft knees?
Bend, a slight bend in the knee. You do not want to lock your knee. When your knees are locked, you're going to have more stress on your joints. When your knees are bent, the muscles are going to work like they're supposed to, taking the stress off of your joints. This includes ankle, knee, hips, and low back. So to get some pressure off of the hip if it's inflamed, you want to stand with bent knees. You don't have to stand this far, just a slight bend as long as you're not locked out like this. And walking, what you want to do is land on your forefoot when you walk, not a heel strike. Most people heel strike because of raised heels in modern day type shoes. You can buy a different type of shoes which are zero or flat or minimalist. You don't want to necessarily start with these right away. Progress slowly. This video is not about that. It's just about forefoot walking to fix your hip pain. So when you walk, try to land on your forefoot. You could pretend like you have some pins and needles in your heel or popcorn kernels, as Brad likes to talk about in other videos. So as you can see, I'm taking shorter strides. I'm not elongating, landing on my heel like this. It's going to be a lot less pressure on that hip joint and make it feel better.